for Guilford County's youngest children and their families by improving outcomes in planned and well-timed pregnancies, healthy births, on-track development for infant and toddlers, kindergarten readiness, and success in third grade. Together, we are pleased to bring you this web-based training on promoting racial equity in Guilford County through our collective participation in the Nemours Integrator Learning Lab. Nemours Children's Health System has selected 9 communities from around the country to participate in an Integrator Learning Lab. Learning labs are a 6-month technical assistance model in which multi-sector teams working on shared population health goals have an opportunity to receive self-directed resources, coaching, and technical assistance on issues presenting challenges to their team. We were excited to meet Ms. Abby Charles and Dr. Mike Royster as a result of participating in the Nemours Integrator Learning Lab and desire to bring their expertise and wisdom around promoting racial equity in organizations and programs to Guilford County. This training will be just one of many that Abby and Mike will be implementing in our community in the coming months. The Guilford County Coalition on Infant Mortality kicked off in 2020 with a racial equity training led by Marisol Jimenez and Tamiko Ambrose Murray. Today's training and future trainings are meant to complement that racial equity training that took place in January and others that have been facilitated in our community within a multitude of organizations. We are grateful to all who make it a priority to conduct these workplace trainings and, more importantly, take the information learned and create opportunities for change in our community. We would like to remind everyone we are recording this training and will be able to disseminate it to those who could not be in attendance. I'd now like to introduce our trainers for today. Abby Charles is the Senior Program Manager of the Institute for Public Health Innovation. She has over 8 years of experience engaging in cross-sector work, starting at the Common Health Action and the Institute for Public Health Innovation in 2011. She has worked directly in the area of health equity since 2016, placing the lens on addressing equity in institutions and institutional practices such as hiring, leadership structure, decision-making, diversity, inclusion, hidden and visible power. Ms. Charles believes that equity cannot be an add-on. It must be integrated throughout the process from beginning to end and all in between. This can sometimes sound like an additional burden that some want to avoid, but in order to dismantle inequities in our society, we have to transform the status quo and put in the work. And Dr. Mike Royster is the Vice President of the Institute for Public Health Innovation. He established the Institute's Richmond office and is expanding and developing initiatives to support public health priorities across Virginia. He provides expertise and oversight for an extensive portfolio of health and equity-focused programs, including community health worker initiatives, training, and technical assistance to promote healthy and equitable communities, health and all policy strategies, and community health improvement planning. Dr. Royster also serves as a principal investigator for IPHI's, the local performance site of HRSA-funded Mid-Atlantic Regional Public Health Training Center. Today, I'd like to welcome both Abby and Mike as our facilitators, and we look forward to having you as our trainers.
Awesome. This is a big group. I have not facilitated an online training with 113 people in it before, so this is going to be very exciting. Just as I share my screen, some basic logistics. We don't want this to be entirely didactic, so we're looking for interaction and involvement. So if you're comfortable with putting your screen on, that would be awesome. It's always wonderful to see who we're talking with and talking to. Ideally, these trainings would have been in person. If you're not comfortable, I know some of us are at home and our heads are tied, and that's how I am usually during the day. So it's also fine if you're not comfortable turning your screen on. We are still going to hopefully have you interacting with us. The other piece is, if I do ask a question, we definitely want responses. So please use the functionality in Zoom to raise your hand. so that we could see the raised hand and ask you to unmute so that you can respond to whatever questions we're asking. And I think that should be about it. Mike, do you have any pieces you want to talk about logistically?
Nothing specific other than to say good afternoon to everybody. We look forward to interacting with you.
Yeah, definitely looking forward to this. So now it's our understanding that, you know, Guilford County has done a lot of work as it relates to racial equity. So we are approaching this conversation from a serious strength-based approach, but recognizing that, especially as we are in a space right now where COVID-19 and the pandemic has highlighted globally, but especially in the US, the inequities that we see and that we have seen for a long time, we're really seeing them come to fore as it relates to the disparities in illness and in death, especially for African Americans and people of color in this country. We think it's especially important for us to continue to revisit the conversation of racial equity. And although we've done trainings and we might understand the foundations and the root causes of inequities, do we really utilize and have the tools that we need to begin to transform how inequities manifest, not only in our community, but also in our organizations? So today, as a first part of our series of trainings, we're really going to dig into organizational racial equity assessments and think about how we might begin to, if some of you on the call may have already implemented some of these, how we will begin to implement these at our organizations. All right. So, you know, I'm hoping this is going to be a little bit interactive, but could someone tell me, what are you seeing right now as it relates to equity, either in your organizations or in your community? What are some of the concerns that you're seeing, and what are some of the successes that you're seeing? I'm going to take about 3 comments. If anyone would raise their hand. You can also type in the chat box. And because we have so many participants, if someone can help me, if they see their hand raised, or just come off mute and say something.
Hi, this is Rhonda Anderson, YMCA of Greensboro.
Mm-hmm.
And I'm relatively new to Greensboro, but what we've done in our organization is to make a concerted effort to make sure that there's an awareness and training our staff on some of the challenges that we see around race. We had committed to getting our full-time staff trained in Racial Equity Institute, but of course those have been canceled until we're able to come out of COVID. But I think education is the first step, and we've made that commitment.
Awesome. Thanks for sharing that. Does anyone else want to share?
Hi, this is Mandy with Chatham Reads out in Chatham County. And we have a huge problem with our district. Our county is very rural. And so our north portion has a lot more equity than the rest of the entire county. So we're having a huge diversity on that between how do you do the best for all children, while, you know, you have some children that even when you provide hotspots, they still cannot get internet, and that sort of, those sort of problems.
Mm-hmm.
And the children are now the caregivers for their siblings.
Mm-hmm. Thanks for sharing that, Mandy. Anyone else want to talk about what are you seeing related to equity in your community or in your organization?
Hi, everyone. This is Mika Sales with the Duke Endowment. And I think, Abby, you made a comment about the COVID pandemic and how that's exposing a lot of disparities. And I think that's laying bare a lot of inequities that a lot of us have always seen. So I think in the philanthropic community, I'm seeing a lot more acknowledgement of the inequities and the disparities, and a lot of more focused targeting of, you know, resources, or at least communication around the inequities that are being laid bare by COVID-19. And then in some places, seeing how that's even causing more questions about overall, you know, funding and targeting processes.
Right, right. Thank you. Keep checking the chat box to see if anybody's typing, but I think people are still introducing themselves there. Anyone else want to share one more? Challenges or successes with equity? All right.
This is Kelly Graves. One of the things that we're looking at, we had a conversation this morning about around equity, is we're thinking ahead about summer camps and how to support families and children with summer opportunities, given that many of the camps are canceled. And then, so, you know, the immediate response is, well, a lot of them have moved online and virtual camps online and all these virtual opportunities online. But if you have difficulties accessing the internet, then those in-person camps moving virtual doesn't really help. And so that's one of the equity issues we were speaking about this morning, is what can we encourage parents and families to do this summer if their physical camps are closed and they can't access the virtual camp options? Like, what resources can we provide for parents and families for that? So that is one equity issue that we're grappling with.
Yeah, definitely. And I see here in the chat box, I hear a lot of people strategizing about rebuilding with equity at the core. There's huge inequities in our data in Guilford County around outcomes, where white folk continue to have better outcomes and are at the top than folks of color. I also see here health literacy and communication in the Latino and Hispanic community continues to be a challenge. There's lack of community engagement when planning, implementing, evaluating, and sustaining programs. And someone shared, you know, that equity in decision-making, when there's inequity in decision-making positions, that creates more inequity as well. So that's a key point that I'm seeing. And housing inequities in Orange County. So it sounds like there's a lot of inequities in the community, but for us, as we think about it and why we thought it would be important to do this training is because, you know, you ever hear that term, like, you can't fix what's outside until you start fixing what's inside. You know what I'm saying? When it comes to addressing equity, yes, having an external lens is really important, and we have to address the inequities in our community. But part of that also involves shining a light on how our organization and our institutions operate, and really beginning to use a strength-based lens to also integrate equity into our hiring, employment practices, how we include and engage members of our staff into decision-making, and all of those other pieces. So today we're going to be covering a couple of those pieces, but I'd like to see, by ideally a show of hands, how many organizations have actually conducted a racial equity organizational assessment? I'm looking. And if you click on reactions on the bottom of your screen, you can choose a hand, I think, as one of the reactions. Okay, I see Mary has her thumbs up. Anna has her thumbs up. Put a thumbs up. Just want to see what sort of expertise we have in the room, because we might call on you to talk a little bit about some of your experiences. Oh, I missed a couple. Marissa has her thumbs up. Awesome. Thanks for sharing. Okay, cool. I can't go through everyone because we want to keep it moving. Oh, sorry. Someone asked if I could repeat the question. How many of you have practiced or completed a organizational racial equity assessment? All right. So today, our key goals, we're gonna, of course, ensure that we're all on the same page as to what Mike and I are talking about related to what does equity mean and what are some of the key terms that we're going to be using for this training. We want to describe the relative contribution, of different determinants on health and health equity and racial equity. We want to explain the importance of intentionally addressing equity in our organizations and in community. Give examples of how organizations can align their policies, systems, and programs to promote health equity. Help you think about how to use a racial equity organizational self-assessment tool. And we're going to develop and implement a plan to conduct a racial equity organizational self-assessment and help you to utilize or think about how you might potentially use the results that you would get from a future implementation of such a tool to help build your organization to promote equity internally and externally. All right, so when we're talking about equity, what are we talking about? And I guess this is where, for me, some of my questions come in. And what we talk about when we talk about equity is really any responsible attempt to define disease must account for the phenomenon's complexity. Disease is a deeply social process, and its distribution lays bare society's structures of wealth and power, and the responses it elicits illuminate strongly held values, right? What do you get when you read this quote or when you understand this quote? Does anyone hand up?
Yeah, Abby, it looks like there's a comment from Kay Keynes, maybe? Loving the focus on inherent complexity underlying observed inequities.
Yeah, I'll just elaborate on that very briefly to say, I love that you kicked off with this perspective because there's a history of systemic forces that have led us to this point and what we can observe at this point, and to treat the surface of that history and that those systemic forces will not radically change what we're observing. So thank you for inviting us to dig into that complexity.
Definitely. I like to start with this quote because as we think about, you know, we've been living with, and thanks, I didn't get that speaker's name, but as we think about what has led us to the place where we see the inequities that we see today, it has taken centuries of building to get us to a place where we exhibit and see these inequities in our society. In order to reverse those and to truly begin to address equity, we have to be intentional to really assess and address the root drivers, the structures of wealth and power, and how those affect our society in order to truly ever begin to address equity. I don't know how you guys feel, but just by observing, I mean, I sit in my house and I'm often moved to tears to think about how our society and how our community and people who look like me are being affected by COVID-19. And I've said time and time again that we cannot allow this to continue. We cannot allow, if there's another pandemic, for people who look like me to continue to be the ones that face the brunt of deaths and disease. But how do we stop that? How do we prevent that? How do we ensure that seniors who are living in rural areas are not left out of the system? how do we ensure that people that speak multiple languages and English is not their first language, that they are not left out of the system? There's serious complexity, and we must be intentional in our approaches to address that complexity in order to address equity, right? And we've been using a lot of terms, but as we think about health inequities, for us, what we define a health inequity is differences in health, which are unnecessary and avoidable, but in addition, they're also considered unfair and unjust. Health inequities are systematic, right? So their consequences are not random, but they follow a pattern, right? So what we see in certain parts of Guilford County, you're also going to see in Richmond, Virginia. You're also going to see in Ward 7 and 8 in Washington, D.C., and Wards 4 and Wards 5, the lower income wards in the city. You're also going to see it in Prince George's County, Maryland. You're also going to see it in Richmond, California. There's a pattern. There's a systemic nature to this. There's a reason why across the country we're seeing the greatest inequities among certain populations, right? Inequities are socially produced, and the patterns can be traced back to the social structures, social determinants of health, and how they are distributed in society, right? And our inequities are unfair. There's an ethical and a moral connotation which is embodied in a sense of, there's a sense of injustice, right? It's unfair that there's certain members of my community who, because they are on the front lines, or because they are considered essential workers, or because they work at the post office, or because they work at the grocery, that they are the ones who are putting themselves at risk more so than others in our society, right? So there's a sense of injustice behind some of the inequities that we're seeing as well, right? Mike, you have any pieces to add so far?
No, not at this point.
All right. So when we talk about equity, there tends to be, and I'm sure most of you on the call understand the difference between equity and equality. But what this diagram demonstrates for us is that difference between equality and equity, right? In that equality for us means that everybody receives the same thing, which we see in this image. That people receive whereas equity shows that people receive based on their situation or need, right? So with equity, everyone gets the number of boxes that they need so that they could see over the fence. Whereas in equality, you all get the same box. Whether you could see or not, it doesn't really matter. So in the case of health inequities, in the case of racial inequities, the answer for us is not necessarily to focus on ensuring that everyone gets the same resources, but the type and degree of resources is based on the needs and the barriers that individuals and communities may experience, right? So the difference in approach between equity and equality means that with equity, there's a real understanding of social determinants of health and how they are distributed across the population, right? Another level of equity would be to address the underlying issues that create the barriers in the first place, right? So in this diagram, it would be to remove the wall itself, or to eliminate the hill, or the different levels of the hill, because then opportunity would be truly equal, right? And then we would be able to achieve equality if we really saw this removed. So for us, equity means that there's just and fair inclusion. An equitable society is one in which we can all participate and prosper. So the goal of equity must be to create conditions that allow everyone to reach their full potential. Equity creates that hope, or that path from hope to change and true transformation. right? And I see there's comments in the chat box, but Mike, because I'm moving the presentation, I can't see them. Do you mind reading a couple of them if they're relevant for the presentation?
Yeah, I think one is really good bringing in COVID. This is from Kelly. COVID is definitely awful, no doubt, but I see rays of hope in that the Band-Aid has been ripped off of what has been under the surface for so long. It can no longer be ignored or confused for something else. So I'm hopeful that maybe, just maybe, we're at a prime spot for mobilization for change where all people stand together for change.
Mm-hmm. Definitely. So we want to get to a place where we see a fair, just distribution of social resources and social opportunities needed to achieve well-being, right? But what I'm seeing, you know, we talk a lot of equity. We talk equity a lot. And I don't know how it's being implemented in Guilford, but I can use COVID-19 as an example. And this is more so community facing. But in our society in DC, where I live, the communities that have the highest number of infections are my neighborhood, actually, Ward 4, Ward 7, and Ward 8. Yet, when they opened up testing sites, where were those testing sites located initially, right? Was equity considered when they opened those testing sites? Did they consider whether people would need to drive to go to a testing site? Did they consider who would have access to be able to get tested? In most places, that was not the initial consideration related to how they made testing accessible, right? So even though people get that equity is an issue, we're still not using the tools that we need to design our systems to truly address the inequities that we're seeing, right? Sorry. So in order to get to equity, and one of the key ways to get around what we're seeing in terms of just reinforcing some of the inequities, we must have diversity. And when we talk about diversity, we just talk about ensuring that there are multiple perspectives involved in whatever discussion. We talk about inclusion. So ensuring that those multiple perspectives, faces, voices, that there's actually power for those voices to make a difference, to provide input, to be engaged in the process. When there's that diverse group of people involved and with power to make decisions, then you're more likely to achieve equity. So in all of our opening up plans and in all of our designing where testing is being implemented, how many of those groups have you seen that include community members? How many of those opening up scene that have truly engaged the communities most affected by this disease in the process of designing what that looks like? I'm asking, and I don't know if people want to respond. How has that been going in Guilford County? You can drop it in the chat box or just unmute. Have you seen community members involved in your COVID-19 response committees for your county or for your state?
Hi, this is Kiva Elliott from Cone Health, and I'm here in Greensboro. And we started a project a couple of weeks ago around community testing, community screening and testing. And we actually did have several different work streams. We had community partnerships. We had health equity and diversity, equity, and inclusion at the table at the beginning. So that helped to make sure that, you know, we were asking the right questions. We were making sure that where we went, that they were targeted, you know, communities that we know we needed to be in. And that community partnership has been so powerful for us.
Awesome.
Being able to connect with them, and they help us find places and secure sites for us to do testing. So I can say that we've done that, and it has really been a beautiful way to bring everybody together and have everybody going toward the same vision, and that's helping, that we're making sure that we're keeping people safe and healthy in,
Awesome.
you know, the areas that's needed the most.
Okay, great. Marissa, did I see that you had your thumbs up? Marissa Bryant?
Hi, yes. Can you see me?
Yes, I can.
Yeah, so we've had a few different community-led efforts here actually to address some of the community members' concerns relative to COVID-19. So we've actually had community members to organize webinars and info sessions to invite some of our public health leaders and hospital leaders as well to kind of mitigate some of the concerns that people had around the disparities that they were seeing across the country. So it's really been interesting just to learn about the different resources and information that people typically don't have access to or they don't know about. So I think that it's been really important for our community members to actually lead this work. And it's been an opportunity for them to get really engaged and learn more about what they can do in the future when we have things like this to happen and impact our community disparately.
Awesome. Thanks for sharing that.
Of course.
All right. So, you know, one of the key pieces just for us as we talk about the social determinants of health, you know, we highlight this slide from the Robert Wood Johnson Foundation Community Health Rankings to highlight the relative impacts of the major determinants of health on our population's health, right? And we know that health behaviors and clinical care account for about 50% of our health outcomes as a population, whereas the other 50% is related to social and economic factors and the physical environment and where we live, right? So our health outcomes are so largely tied to education, employment, income, family and social support, community safety, environmental quality, and other pieces, and the built environment. Yet, where we invest our resources as it relates to health is in our health behaviors and our clinical care space, and really is only in the clinical care space and not necessarily as much in the health behavior space. But, you know, when we think about medical care, that's what people usually think of in the context of health. It only accounts for such a small amount of the differences in health among populations, right? So we should be really thinking about how we could invest more in these other social factors in order to address health. Key for us as we are thinking about our work as communities, institutions, etc., to address health outcomes. And this last sort of definition and term slide really highlights what we see as relates to the structural factors that affect our health outcomes. So it's almost like it's another demonstration of that last slide that we saw, where we see that health is determined by individual factors such as age, gender, genetics, individual behaviors, diet, exercise, addiction, and coping, which are often also related to the other levels that we're going to talk about, the personal services and infrastructure, living and working conditions, all affect people's individual behaviors. But how those factors, such as air, water, and soil quality, working environment, the jobs that are available, transportation, community centers, etc., how those are all distributed are tied to the social, economic, and political factors, such as political participation, social cohesion, segregation, and the history of segregation in communities, inequalities, poverty, and racism. So this is the structure with which and the framework that we approach our work in race and health equity really focuses on thinking about population health really tied to those social, economic, and political factors and the policies that drive these inequities. Now today, we're really focused on inequities also within our organizations and thinking about how do some of these factors affect inequities in our organizations and in the decision-making that occurs in our institutions.
I'll jump in here and and build on what Abby has been presenting so far and really give kind of a framework for how we like to think about equity and addressing equity. And we think about it from the standpoint of how do we dismantle this system that has created and continues to create inequitable outcomes over and over. The first piece to it is around identifying the disparate outcomes. And that's really, using data to understand the differences in health outcomes and the risk factors that may be associated with them. So we may be thinking of things like heart disease and even behaviors related to them and access to care and those traditional factors. And then going back to that concentric circle slide that Abby showed, we want to go beyond just those individual level factors to the broader social, economic, and environmental factors that really shape outcomes. They shape people's behaviors, whether they live in a community where there's healthy foods, whether they have a healthcare provider or a pharmacy in their community, as well as affecting their stress levels through challenges of living day to day when you have limited economic resources or you're experiencing racism as a part of just the daily life that you live. So recognizing and using data to uncover how those social determinants are distributed by race, income, gender, disability, and other factors. And then the second piece that we really focus on, and what Abby touched on as well, is thinking about the community role in both understanding the issues, identifying the strategies, the opportunities to improve health, and really thinking about it from an assets standpoint of what are the assets that communities bring to the table to promote their health and the broader health of the community. And so part of that is an extensive focus on affected communities that are experiencing health inequities. Abby mentioned that when she asked, are communities facing inequities at the decision-making table related to the COVID-19 planning? And so that's critical to have to help understand and address inequities. And then also partnering with the broader organizations. Certainly on this call, it seems like there's a range of community organizations, government, different sectors that are critical to addressing, as we go back to those social determinants of health. Folks in public health and medicine don't have direct control over transportation decisions or housing decisions, but we know that those are critical to health outcomes. And so then the third piece is taking that data of understanding the issues and the communities that are affected, and then really looking at exposing the systems that exist in our communities and our society and structures that create racially inequitable outcomes. And we do that at the both at the organizational and at the broader societal level by asking questions about who is marginalized here and why. What are the structures that are creating the outcomes? How are things set up now that are perpetuating these inequities? And then how can we intervene to change those structures and outcomes? Who do we need to engage in the process? Again, that important aspect of including communities. And then thinking intentionally about the policies, programs, processes, and systems changes that need to occur to make a difference. And then how can we make sure that these strategies don't disenfranchise, so that while we're moving upstream to think about those higher level policies that really shape the environments where people live, that shape the opportunities that people have, it's important for us to also consider or ensure that we're not reinforcing or creating new inequities unintentionally through those policies. So quickly, just wanted to take a pause here as we all digest this. And just a quick, going back to these three components, and we talked a lot about the community piece, and we even started to talk a little bit more about the systems and who's done an organizational assessment, and we'll definitely get more into that as well. I am curious at this point in terms of how you've seen data being utilized, and is it being analyzed in a way that helps us to really uncover inequities and people who are affected by those. Does anybody want to share, either verbally or in the chat box, anything you're doing or observing in relation to how data is being utilized? I see let's see, I see a comment from E.S. Biddle, maybe, saying that the Guilford County Health Department has still not realized data on testing, hospitalizations, and deaths disaggregated by race. And so we know that that's been a big challenge, across the country. And so it sounds like it's something that Guilford County is experiencing as well. Do you know if there's efforts to disaggregate that data and make that available to help decision making? Does anybody, does Biddle want to respond to that? I'm not sure. I'm not sure what the first name is, or anyone else with familiarity. Lizzie Biddle is the name. Thank you. So we're putting Lizzie on the spot, I think. But yeah. So I won't continue to see if Lizzie has anything else to add. I think she's made a good point regarding the data, and she says that the data has been requested. So hopefully the health department will be able to make that data available. And I know part of the challenge, and certainly in Virginia, has been that all of the data that the state health department is receiving in Virginia does not have racial and ethnic information attached to it. So I think they said at one point it was about half of their reports had race and ethnicity data. And so that's another challenge that not only the health agency or entity, but how do we encourage and support the labs to report that information as well. So that's just one example.
Mentioned that they disaggregate data based on race, income, gender, in terms of the termination of treatment services and client satisfaction, but that they can do a lot better, and look forward to learning more of how to do that. Tribal groups in North Carolina are often not represented in the data, but are often clustered under other.
Yeah, and so that's a good point, and a challenge then in seeing if there are unique risks or exposures that the tribal communities may be experiencing. And so as we think then about how we can intentionally really make changes at the level of our organizations, we're really talking about how do we address the issues of oppression and racism at the institutional level. So if we can go to the next slide, Abby. Because the decisions that we're talking about, whether it's around data or screening availability, or I saw some comments earlier about transportation and housing being issues. Those are decisions that are made obviously within organizations and institutions, within the health department or the housing authority or the transportation agency. And those decisions that they make externally affect equity, as well as decisions that they make of how they structure themselves, and whether they're prioritizing equity also influence whether we're able to move towards an equitable society. And so for the focus of this presentation, then we really wanted to hone in on that institutional level of oppression and racism. And here you see, as we think about it, of 4 levels of how oppression, whether it's racism, classism, sexism, or other forms of oppression, play out at 4 different levels. The personal level in terms of our values and beliefs, the interpersonal level in terms of how we interact with each other, the institutional level, which we'll spend most of our time on, and the cultural level in terms of the worldview, the norms, the stories, what we value as a society. They all interconnect. And so if we talk about one, you can't exclude the others. And at the same time, from the standpoint of our organizations that we work for, or are a part of, we can be very intentional about thinking about how we can work within those institutions to address policies, practices, et cetera, to promote equity. And so when we talk about the institutional level, what we are talking about then are those policies, practices, or customs that create differences in people's inclusion or chance of success. And one way to evaluate it is to think about, how does my institution favor members of the included group, or conversely, exclude members of other groups. So an example, we've talked about a few already, whether it's testing sites being, an intentional policy to set up testing sites in low-income communities that may be higher risk for COVID-19. An example that I can share from my personal experience, I was previously a health director in Virginia, and when I joined the health department, and as you all know, health departments focus their care on oftentimes more so of people with lower incomes, who are uninsured, immigrants, et cetera. And yet our policies around the services we provide said that we were open from 9 to 5, actually 9 to 4:30, and that we had our clinics in the middle of the day from like 10 to 12 or 1 to 3. And that we had intentionally, or I should say, we had a lack of a policy in that we did not have an interpreter. So we hadn't identified that as a policy priority or put the funding where it needed to be to provide an interpreter. And so from that standpoint, I'm sure it would seem clear that our policies were not in place to serve or include specific members of our community, including people who worked shift jobs, who weren't able to get off from work in the middle of the day. If they didn't speak English, if they only spoke in that community, it was primarily Spanish, they couldn't receive services because there was no one that they could communicate with or communicate through. And so those are examples of policies that we had in place that excluded certain populations. I'm wondering if, and I see there's a lot of chat on there now, Abby, I'm not sure if any of these talk about any institutional policies that folks are seeing related to equity.
Not necessarily. There's some broader questions related to the desire to maintain the status quo, and one related to, politics. So how do we improve voting to make sure that all voices are heard? So definitely higher level institution, but still institutional and cultural, ensuring that there's engagement of the community in political process. And when the status quo is to maintain power for certain groups, how do we truly turn that over on its head? And that relates to institutions at times too. So I think we will get to some of those pieces.
Yeah, definitely. But I do want to see if there's anyone who would want to share, either verbally or in the chat, any examples of institutional policies they're aware of, either that have excluded certain populations, or ways that institutions have intentionally developed policies that are really are intended to be more inclusive. Any examples of policies? Well, I see here's general or COVID related. It could be either or. So yeah, please share.
Could be anything related to anything.
I do see from Kay Keynes, the state school report codes no longer disaggregate school performance by racial groups, or the report cards no longer disaggregate school performance by racial group. So that, it sounds like that's a policy decision at some level that is actually, maybe has the intent to, to avoid focusing on racial inequities in school performance.
Someone said lack of Medicaid expansion in North Carolina as a policy level issue. How schools are funded in North Carolina by federal, state, and local leave a large inequity between different districts as well.
Yeah. Yeah, and then I see that philanthropy relaxed some criteria to provide funding during COVID. So that was sounds like a policy change that was intended to help make funding more available to communities affected. So these are good. Oh, go ahead, Abby.
Communication only in English. Not policy, but access. So working with a team a few years back, worked with DSS, Disability Services, with their intake process to make it more accessible to deaf or deafblind customers. Some policies to access social support funding were relaxed by the federal and state during COVID-19. Requiring photo ID or social security cards for services is a way to exclude certain groups, for sure.
Yeah, so I think these are some great examples of policies that include and policies that exclude. And I think it does go back to some of the earlier conversation about voting and power, that oftentimes, well, you know, certainly people in different power positions have incentives one way or the other to advance policies that are more inclusive or exclude more. And part of the strategy then is to influence those decision makers, or to reshape who the decision makers are even. And so on the next slide, we'll look at some examples of institutional level policies. And one of the things I would say is to think about this really at two levels. We're looking at a lot of these, you know, very important policies that are oftentimes at the level of legislative decisions that are made. And at the same time, there's decisions that our organizations make and how we decide to function as an organization that affect how effective we are in promoting equity. So I'd encourage us to think about, you know, those broader legislative policies as well as policies and systems within our organizations. And so at the institutional level, some of the ways to move towards policies that are more equitable and inclusive are to review existing policies and practices for their equity impact. We won't go into great detail in this presentation, but we oftentimes will spend a whole hour talking about an equity impact review tool, which is we've developed and adapted one that's several pages that is intended to be used to help review existing policies or to create new policies, and to do so in a very equitable manner. So that's an example. Similarly, creating institutional accountability and policy change. So if not only are we changing policy, but we're holding ourselves accountable, whether it's through evaluating the impact of the work that we do, or getting feedback from the communities we serve, things like that, to ensure that our institutional level policies and systems approaches are truly promoting equity. Another aspect at the institutional level is to analyze power dynamics and restructure them. And that can be done internally in terms of who within the organization makes decisions or has power to influence those decisions. Abby talked earlier about diversity and inclusion, and this is kind of where this fits in, at least in one way, that we may have a diverse workforce, but if they're not included in the decision-making process, then they're effectively not helping to create policies that have a broader lens in terms of equity. And so if we look at those power dynamics within our organization, we can address those. And similarly, external to our organization, when we are working with communities, certainly there are power dynamics, power differentials between, say, the health department and the communities that they serve, or the housing authority and the communities they serve. And so as we as organizations commit to sharing power more with the communities we serve, then we can get to that point of making more inclusive decisions. And that brings us to engaging stakeholders and clients in that policy and service development. that as professionals, we have a lens that we've been trained to have that, influences much of what we see and do, but it also creates to some extent a blind spot potentially where we need to have that perspective of people who are stakeholders, our clients, the communities we serve, to truly understand how they see the priorities and what they see as the solutions.
Yeah.
And that, Abby?
No. I was just, yeah.
And then the other piece is around building movements, that as we as an organization become more committed to equity and that we reach outside of ourselves to engage the communities we serve, it's important for us to also become a part of those movements that want to change the broader systems and structures. And to me, that kind of goes back to that conversation about voting. And ultimately, there's people in decision-making positions that shape what communities look like in Guilford County and who has access to what resources to be healthy. And if we as an institution are partnering with communities and other organizations and advocates and faith communities to challenge that status quo, then we can have that broader impact as well. And so if an institution commits to that and builds the infrastructure to do that, then at the institutional level, that's another way they can commit to equity.
Yeah. And Mike, related to some of these policies, I was working with a stakeholder group that pulled together different hospitals to complete community needs assessments. And that stakeholder group had decided that you had to be either a hospital or a health system to be part of that stakeholder group, right?
Mm-hmm.
And in their analysis of issues in the community, they had a community advisory group that met every once in a while to provide some input on their decisions. But just by creating that structure, I'm curious to hear some of the thoughts of the participants about what sort of power dynamic does that create, and is that true engagement of community into the process of designing community needs assessments and community health improvement plans? What does that dynamic dictate or state? What does that power dynamic look like to the community that's most affected? Mm-hmm. I don't know if anyone has any thoughts. Okay, no thoughts? Maybe I should call on people. No. The two groups are still separate. There is no true sharing of ideas and thoughts, very much so. But also, when you are making decisions for a community, is that true stakeholder engagement? Is that equity? No. Equity involves, and I think our center piece spoke to, true engagement and leadership of persons with lived experience into any process. So that does not look like we just have an advisory group of people from the community. That means that you should be going to the community to lead that decision-making process in real time, right? But our organizational policies set up those, we are only going to have hospitals involved in this process. That's an institutional policy that's been set, or policy small p, but it's decision making that's been established that defines who gets to make the decisions. So yeah. Mike, you ready for next slide?
Yeah, is that me or is that you?
No, I think it's me.
Okay, yes, I'm done, thank you.
All right, so we wanted to highlight, as we move more so into looking at institutions and organizations, and how do we become more anti-racist as organizations, because a lot of what we've been talking about as it relates to equity is grounded in racism and racial disparities that are driven by historical racism. So this is a really interesting continuum that's developed by the Crossroads Ministry of Chicago, Illinois. And it was adapted from an original concept by Bailey Jackson and Rita Hardiman that sort of sets a continuum of where organizations lie as it relates to being anti-racist, multicultural, or monocultural. And we'll talk a little bit about what these terms mean. So you can be an exclusive organization, right? Where you're exclusionary as an institution. So you intentionally and publicly exclude or segregate certain groups of people, intentionally and publicly enforce the racist status quo through institution. Institutionalization of racism includes formal policies, practices, teaching, and decision-making on all levels. And there's usually intentional policies and practices towards other socially oppressed groups, such as women, gays, lesbians, third world citizens, etc. And you openly maintain this dominant group's power and privilege, so exclusive. And I'm not sure that there are many of those organizations in existence in the US anymore, but can someone think of an organization in the past that may have been one that's exclusive? Any thoughts? The church, okay. The Catholic Church currently excludes women, definitely. Definitely, okay. I could think of historically, maybe not necessarily written in policies, but when I think of certain clubs or fraternities in the past, oftentimes there were categories of groups that were not included because of their skin color. And that could be considered an exclusionary type of institution, right? The military used to, the Red Cross excludes gay men, different country clubs, social and civic clubs as well, for sure, could be exclusionary, okay. There's also a passive groups, right? So tolerant of a limited number of token people of color and members from other socially identified groups, right? May still secretly limit or exclude people of color in contradiction to their public policies, but they continue to intentionally maintain white power and privilege through its formal policies and practices, teaching and decision-making on all levels of institutional life. Often declared that we don't have a problem, right? But there are monocultural norms, right? Where there's only one culture that's acceptable, and that's the dominant culture. That's the right way, and business as usual. And they engage in issues of diversity and social justice only on the terms of the club members and within their comfort zone, right? Am I seeing what I'm seeing in the chat box? Churches are still exclusionary organizations generally. Many are trying to bridge the gap, but the church has racial exclusions, gender exclusions, etc. Definitely. Groups that are trying to engage in symbolic change, right? So they make official policy pronouncements regarding multicultural diversity. So we want to be more diverse. They see themselves as non-racist, with open doors to people of color. They carry out intentional inclusiveness efforts, recruiting someone of color on each committee or on their office staff. They have an expanded view of diversity that includes other socially oppressed groups, but not those who make waves, not those who are really loud. Little or no contextual change in their culture or institutional policies or decision-making processes. They're still relatively unaware of continuing patterns of privilege, paternalism, and control that occur within their organizations. And there's token placements in staff positions, but you must assimilate into our organizational culture, right? So we're moving closer towards this anti-racist multicultural organization, but we still have some areas that there could be significant improvements. There's organizations that identify change. So we have an understanding of racism as a barrier to effective diversity in our organization. We develop an analysis of systemic racism. We sponsor programs of anti-racism training. We develop new consciousness of institutionalized white power and privilege. We develop intentional identity as an anti-racist institution and begin to develop accountability to racially oppressed communities. We increasingly commit to dismantle racism and eliminate inherent white advantage. We actively recruit and promote members of groups that have been historically denied access and opportunity, but institutional structures and cultures that maintain white power and privilege are still intact and relatively untouched, right? So we identify that change is needed, but there's still this power structure and power dynamic that isn't really gonna change. When we look at an organization that's a transforming institution that's really looking at structural change, they've committed to the process of intentional institutional restructuring based on anti-racist analysis and identity. They audit and restructure all aspects of institutional life to ensure full participation of people of color and other groups, including their worldview, culture, and lifestyles into the organization. They implement structures, policies, and practices with inclusive decision-making and other forms of power sharing on all levels of their institution's life and work. They commit to struggle to dismantle racism in the wider community and build clear lines of accountability to racially oppressed communities. Hold us accountable, right? Anti-racist multicultural diversity becomes an institutionalized asset. It's an asset that we are not just diverse, but we include all communities into our processes as an organization. And we redefine and rebuild all relationships and activity in society based on those anti-racist commitments that we've made, right? And then lastly is the fully inclusive, fully anti-racist multicultural organization in a transformed society, which is a future vision, right, of an institution that has and a wider community that has actually overcome systemic racism and all other forms of oppression, right? So that's our dream goal, which we're not at yet. But what I'd want you to think about, we definitely don't need to include it in the chat, but think about where your organization is, right? This is a point of reflection, to think about where might your organization or institution or government agency be in this scope of working towards multiculturalism? And where do you want to be? Because that's a key piece in terms of thinking about, as we are working on equity externally, are we truly doing work to address equity externally if we are not doing work to address equity internally? Right? So think about where you are and where you want to be. And that's the level of intentionality that you want to approach conducting organizational racial assessments with, right? So we're going to move on to talk a little bit about these organizational racial assessments. So we want to be intentional when we're designing these tools or implementing these tools. What are we trying to achieve? What's our goal? What level are we trying to get to as an organization? How do you foster a safe, non-judgmental environment for the process? These are some of the guiding principles. Like, you know, when we're doing these organizational self-assessments, there shouldn't be any blame. Much like engaging in quality improvement, organizational self-assessments are a process for you to reflect on where you're at, utilize the skills and the resources that you have to think about how do we improve, but never shame or blame or create judgment. But how do you foster a safe and non-judgmental environment for that process to move forward? You want to facilitate meaningful engagement of your stakeholders as a core part of that process. So true organizational assessment involves including community partners to give their perspectives on what the view of your organization and community is as well, right? True engagement of staff, of diverse staff into the process is really important. And we want to use a strength-based lens. We want to think about what are the strengths and the capacities that we have, and how do we continue to enhance and improve those strengths to foster increased diversity, inclusion, and equity in our organization. So you want to build on and optimize those existing strengths and assets of excluded or marginalized groups as well. You want to utilize your results to enhance the capacity of your organization rather than to label or say, you know, my organization is a negative one. How can we improve, right? How do we get better as an entity? As you do your racial equity organizational assessment, whatever findings, you want to disseminate them widely within your organization and externally so that others are holding you accountable to your process. A lot of organizations will start by disseminating it internally, but it doesn't work to do a racial equity assessment and not share those findings with your staff. Like, they have to be a part of the process of ensuring that organizational equity improves. And a key philosophy is that achieving equity is not a finite project. This is an ongoing, constant process and an ongoing cycle of improvement. So you want to get the results from that first assessment, think about how you're going to implement them, do an assessment again in the next cycle, look at how you can improve, and constantly work towards improving to achieve equity. So what are some of those considerations for deciding on a racial equity organization self-assessment tool? Well, first of all, you want to think about how much time do you have to complete this, right? A lot of us are super busy, so we don't have a lot of time. But thinking about how much time you have, and when we look at the tools, you'll be able to better understand what type of tool do we even select to use. You want to think about your organizational capacity. Are there staff assigned to support this work? Are there financial resources assigned to support this work? You also want to be mindful of the type of organization you are, because there's different tools that benefit different types of organizations based on how those tools were created. And you really want to think about, what are your organizational goals? What are you trying to achieve? Where are you trying to get to, whether it's on that spectrum or otherwise, as it relates to diversity, inclusion, and equity? All right, Mike?
Yeah, so at this point, I'll walk through a few organizational self-assessments to give you an idea of what's out there, and you know, kind of look at what their strengths are and what kind of context they might be most useful in. The first one is the Annie Casey Race Matters organizational self-assessment. And this tool is really designed to raise organizational awareness, as Abby talked about, of knowing where you are as an organization in terms of promoting racial equity specifically. It's also an opportunity to start just conversations as folks go through the assessment. It can spark conversations to gain greater understanding of how the organization is functioning, and if people have different perspectives on that. And then also, again, all of these tools I think are really about helping to create an equity action plan. You know, once you find out the strengths and the opportunities for growth for your organization, then you can create a plan to move in that direction of where you want to be, and then use the tool itself as a way to help track progress. It's actually a short tool. If you've seen it before, and I think we have the handout for it. It is literally, the assessment itself is all on one page. Two pages. You might need really good glasses, if like me, to read it, but it still fits on a page or two. So it's very brief. It has two sets of competencies: staff competencies and organizational competencies. And under staff competencies, there's simply 9 questions. And all of these are rated on a scale of 0 to 3. And so the staff competencies focus on things like, has a staff received training on equity? Are they comfortable and competent discussing issues around opportunity? Are they culturally humble? Are they familiar with how to disaggregate data, kind of like we talked about earlier? Do they use racial equity analysis? Again, a tool to look at individual policies and procedures to analyze how effectively they promote equity. And also assessing things like, do the written materials that staff produce reflect an equity framework? And do they understand the implications, the cost of not addressing inequities? And then the second category is on organizational operations. Again, there's 10 brief questions scored from 0 to 3 about, does the organization explicitly commit to equity, whether it's in the goals, missions, vision, and do they have a team within the organization to lead the work and to support the rest of the organization in moving in that direction? Again, a lot of the best practices show that having that committed group that can help move the organization forward is critical. And then also thinking about, it asks, are resources allocated to commit to the commitment to equity? Is capacity building and asset building a focus of the organization for people of color and communities of color? Does the organization focus on results and tracking to see that they are promoting equity? A key piece here as well is the leadership diverse? Is there leadership representation from communities of color? And I know there was a comment earlier that we didn't get to, but someone really stressed the importance of having people in decision-making positions who represent the whole community. And I think that's what this question is really looking at as well. And then also looking at the staff and board and how they focus on equity as a part of their ongoing work. The overall composition of the workforce, and is the organizational culture inclusive and multicultural? And then also, do they have a mechanism in place to address any complaints around racial equity? So while this is a very short tool, it's fairly comprehensive in giving a good idea of where the organization is and help it to move along. And so for an organization that's committed to equity and has limited resources to really devote into an organizational assessment, this would be a great tool. The next tool that we will highlight is the Institute for Healthcare Improvements Health Equity Self-Assessment Tool for Healthcare Organizations. And obviously by the name, this is very focused towards hospitals, health systems, other providers of healthcare in the community. And so it's really structured towards that audience, while also having questions that can be used universally. But again, it's really, as the others are, intended to help evaluate where the organization is in terms of equity, and then to prioritize, develop an action plan, and to even track the progress. This tool is a little longer. It's several pages with multiple questions, so it is a little more in depth than the Annie Casey tool. So it would potentially require a little more time and resources to complete, but it is structured around 5 different categories. Is health equity a strategic priority? So does the leadership promote equity? And is equity funded sufficiently? It also focuses on developing structures and processes to support health equity work. So again, things like an internal equity committee or a governance structure that helps to advance equity, as well as other resources being dedicated to equity, whether it's sufficient staff or office space or other resources that can help the movement towards equity. The third category that it focuses on is deploying strategies to address the determinants of health. And so from the standpoint of a healthcare organization or a health entity, this is really thinking about things like collecting data on race, ethnicity, and language, having a quality improvement system that looks specifically at inequities in terms of looking at data around who receives what care, what are the outcomes by race, ethnicity, insurance status, neighborhood, et cetera. And then I think a potentially unique and important role within hospitals, oftentimes, which are considered anchor institutions, is that they have the ability to, hire many people. And so are they hiring folks from diverse communities and contracting with businesses that are businesses of color or women-led businesses, things like that. as well as using their resources to create community spaces and their community benefits funding in particular to be very intentionally focused not only on providing care for people who don't have insurance, but how to use those funds in creative ways to address some of the neighborhood conditions that are causing people to be sick and to be needing to be seen in the hospital. And then another example is working internally to focus on health behaviors for organizations. The final two components of the assessment are, focusing on institutional racism. So whether that's looking at the physical design of the facilities, are they welcoming to diverse communities? Does the healthcare entity accept health insurance from disadvantaged populations, whether it's Medicaid or I know that in Richmond, Virginia Commonwealth University has a Virginia Coordinated Care program where they provide care to those who are underinsured or uninsured. And then also is there staff training on dismantling racism? And then finally, assessing how the institution partners with community organizations. So this again is a very useful tool for healthcare organizations, has a little more depth than the previous one, and so it could be really valuable in a lot of settings. And then the third and final one that I'll mention is the local health department organizational self-assessment for addressing health inequities. And this is from the Bay Area Regional Health Inequities Initiative, or BARHI, which is a collaboration of the local health departments and other entities in the San Francisco Bay Area. And this assessment is rather extensive. The document itself is over 100 pages and has multiple components to it, but it is very detailed, and again can be used as a baseline to inventory how the health department is currently its current capacity to promote equity, as well as to guide strategy and action planning, and then to assess progress. Briefly, there are a number of tools that are involved. There's a staff survey, and you may have different perspectives from different staff in different parts of the organization, so that can be valuable. There's a collaborating partner survey, so that you're not only getting that input internally, but you're also getting input from the people that you serve. There's staff focus groups. There's a management staff interview tool, and a human resources data system worksheet to look at the diversity and inclusion of staff from diverse backgrounds. The tool focuses on 9 domains within organizational characteristics, many of the same domains that we discussed in the others, such as an institutional commitment, hiring practices, supporting innovation, data, etc. And then there's 9 domains on workforce skills and abilities. Similarly to some of the others, looking at what's the workforce's personal attributes in terms of passion? Do they have self-reflection, listening skills, all things that are critical to being a part of an organization that promotes equity, as well as do they have an understanding of equity issues and how to address them? Do they know how to collaborate effectively with community-based organizations? We talked about the importance of community voice, but do we have staff in our organizations that are skilled in being able to make those collaborations and partnerships? And then, of course, cultural competence and humility. So there's a number of different domains that they assess. And again, this tool is I think, the gold standard in the standpoint of local health departments. I know that it's been used many places around the country. But again, all 3 of these tools can be valuable in different settings and can help an organization move along towards their commitment to equity.
Mm-hmm. Now, at this point in the training, we would put you in groups of your different organizations to actually start walking through some questions on one of these tools to at least begin to practice having some of these open and rich discussions around where does your organization stand as it relates to these different categories that are so important as it relates to health equity. And, I don't know how many of you have heard from community members like, oh, we don't trust that hospital, or I'm wary to go to that hospital because they don't look like me, right? That speaks to organizations that sometimes lack the diversity and inclusion and equity that is needed to truly represent and serve the communities that are most affected by our health inequities and that we're seeing. So those are some of the key pieces that we want to think about as organizations. How are we reflecting our communities? How is equity integrated into our structures? What's the reality of who we are employing, who we are showing the community's face is our leadership? And are there opportunities to expand what our organization looks like, right? So in thinking about developing and implementing one of these racial equity assessments, you want to ensure that you have leadership from your leadership. So this has to be something that leadership buys into, because you're not going to get anywhere if leadership does not buy into any of these processes. You also have to secure buy-in organization-wide and ensure that everyone shares the vision. So you can't come into a process thinking, all right, we are going to be an anti-racist, multicultural organization. And everybody else is on the page of, you know what, we just need to be somewhere in the middle here. Like everyone has to be bought into whatever the vision is in order to get there successfully. You want to include community partners and key stakeholders in meaningful ways. And I think we've talked about that multiple times throughout today's session. Mike mentioned ensuring that you have a team internally to ensure fidelity to the process and ensuring that the process is true and sticks throughout. It can't just be one person. There have to be multiple people working together to see this through. You want to allocate resources and personnel, or resources or personnel, vice versa. So do you have the capacity and the resources to not only do and complete this assessment, but to analyze the data, disaggregate the data by race, place, disability, gender identity, sexual identity, all of the above, to really look at how do disparities and inequities play out even within your organization, right? So you want to allocate the right resources to do that analysis and then implement the what do we do next? And ensure that there's significant time set for completion of this cycle, right? So you want to set a calendar for process and set realistic timelines to implement changes that will occur or that may occur as a result of doing this study. And then you want to analyze and disseminate data, right? Discuss how you're going to use the scores from the assessment and what happens next. It doesn't make us, it does make sense to do an assessment because the conversations that you'll have will be so rich that it will be progress in itself. But at the same time, it's important for staff buy-in and trust to take the results and to try to make some changes and to implement some of those steps. And then think about how you're going to operationalize this, how you're going to make sure that this actually happens. So what are some of the pieces you want to think about as you are trying to advance equity? You want to think about, these are some of the bucket areas that you might want to improve. One is your internal workforce capacity. So you want to enhance staff, and somebody mentioned that they are trying to ensure that all staff receive equity training, right? So you want to enhance staff capacity to explore the underlying causes of inequities. And you want to have an ongoing process of education, structured dialogue, and organizational development in your processes. The next level is your organizational policies and practices, right? So you want to develop organizational infrastructure to support the changes that need to be made. The third piece is looking at community engagement and partnerships, right? So ensuring that community voices influence decisions and that you're partnering with diverse stakeholders, not just the same organization that's always at the table, but really thinking about how do we reach out to that, housing association? How do we reach out to these other groups to ensure that they are part of our process? Establishing a diverse and inclusive workforce. So ensure that your workforce represents the diversity of the broader population and is equitably included in your organizational is a priority, right? So as an organization, if you are in a community and the majority of that community are people from diverse communities, right? And your organization does not look like that at all, you might want to ask some questions. What are some of our policies or processes that are reinforcing some institutional practices that keep our organization from looking diverse like the community we live in looks like, right? What are some of those pieces that might be barriers? And then you want to look at data and information. So strategically utilizing data to identify inequities, root causes of those inequities, and strategies to promote health equity, client satisfaction, and outcomes. And then, of course, leadership. Equity begins at the top and filters through the entire organization. So if equity is not a priority for your leadership, there's an opportunity to think about how do we ensure that equity becomes a focus for our leadership. So that's just an initial start. Because I was sharing my screen, I couldn't drop in the comments the links to all of these resources. What we do have is we have each of those tools in a folder that I'm going to send right now as I stop sharing the screen. So we will, yeah, I'm going to drop this link of resources in the chat box for everyone to have so that you could access the slides as well as all of the tools that we referenced in the conversation. But we wanted to open this up for discussion. Any questions or thoughts that individuals might have related to implementing organizational racial equity assessments.
Abby, there's a comment that I just saw. I think it was from Dawson, and I was going to share just the latter half of what Dawson said. That, and it was as you were discussing the key pieces to an organizational equity assessment. The key is to go deep. There are multiple layers, as highlighted here. So often we stay at the surface level, and when the work gets real and tough, we shy away. We need our equity warriors to step up. This work can't be led only by our underrepresented members. Mm. And I think that's a good representation of, you know, that while the community can provide leadership and guidance in terms of how they see the issues, it also requires that partnership with those folks who are in these leadership positions and these organizations that have this level of influence to really be committed to equity as well. So I appreciated that comment.
Yeah, someone said, I see a lot of strides in Guilford County to increase diverse representation, but there's still a lot of tokenism and paternalism when it comes to decision-making and positions of power and authority. So this training was fantastic, thank you. And it would be great to see it expand to other social service sectors. But yeah, so, you know, some of the work that we do really looks at what is true community engagement, right? How do you distribute power to ensure that the community is empowered to be in leadership as well? And I think that's going to be part of one of our future trainings too, that we think about with this group. Yes, we can also send the link via email for sure. I did drop it in the chat box. Someone said, in order to achieve true equity, we must have real conversations about race, those that may hurt people's feelings on both sides and not just about race. True, definitely true. And, you know, for us, this work is something that we as an organization are still in the process of learning how to do as well, right? So we are constantly trying to assess our organizational culture and how we manifest in community as a public health institute, but also some of the networks that we're a part of. You know, as a national network of public health institutes, there are many of us, and, you know, some questions have come up as to who's the leadership of our public health institutes. We're doing work in equity. How do we ensure that our leadership also reflects the diversity of the communities that we're serving? And that's going to require constant assessment of how do we decide who are the leaders in public health? You know, when you talk about the old boys network in hospitals, that's not a coincidental. That's not a coincidence. That's a status quo. How do we begin to transform that status quo? That takes questioning, thinking about what are our hiring practices? What are our implicit biases when we are employing leaders for our organizations? And how do we begin to address those implicit biases so that when we're interviewing someone, we're interviewing them for the strength of who they are and not based on what they look like or the networks they're connected to, right? Someone said there's lots of resources in Guilford County. Yes, for organizations and the Ready. There's Greensboro Health Disparities Collaborative. Yes. The Partnership Project and the Racial Equity Institute. Yes, and we've heard so much about these phenomenal organizations. Actually, the research of the Greensboro Health Disparities Collaborative, like at the initial Nemours presentation, I used that work as an example of phenomenal racial equity work that was happening in North Carolina. So I'm definitely familiar, and there's so many resources right here, not right here, that you guys have that you can use to advance equity. Other pieces or questions?
Yeah, I'd like to throw in a question if possible. I was typing it, but I'll speak it. You know, one of the last bullets, I think, in the assessment was operationalizing equity. And so I'm curious about, I'll say it this way. We know how hard this work is and the toll that it takes on the individuals leading it and pushing it forward. So I'm wondering, do you all have examples of communities building, like, I'm thinking about like communities of practice or cohorts of organizations that are doing this type of work? So I can imagine, like, even here in Guilford County, I'm in Charlotte, but work a lot with Ready in Guilford County. Like, what if there were a handful of organizations that did this assessment and then had a community of support around what to do about it? Do you all have examples of communities we can look to that are organizing themselves in that way so that they can stay supported and grounded and strengthened in the work?
Yeah. Mike, maybe you can give an example of some of the work happening in Petersburg and in some of those areas as well. Mike, can you hear me? Oh, sorry. With the Cameron Foundation and that community of practice that was built.
Yeah, thank you. Boy. Yeah, so yeah, as a part of our work with a foundation in the Petersburg area, Petersburg, Virginia, they established a community of practice, or we helped them to create a community of practice for different organizations that were committed to advancing equity in their work. And so it involved, you know, a broad range of sectors, whether it was the health department, you know, different local government planning department, you know, some faith-based communities and others. And the key the piece that tied them together was the commitment to equity and operationalizing it in their work. And so the intention then it was for each group to, we provided some core training, and then each of the organizations would look at how they could implement strategies related to equity, whether it was around data or community engagement, and have sessions as a part of that community of practice, where there would be some content shared around, say, community participation and what that means. And then the partners would share what they're doing, challenges that they may be having, or successes that they have. And I think the value in that kind of approach is that it allows diverse organizations across the community. There's still these common approaches that we talked about in this organizational assessment to how they can operationalize equity, and they can learn from each other even in different sectors, as well as learn how to collaborate more effectively across those sectors as they try to engage communities, or as they utilize data and share data across across the planning department and the health department and housing, to really bring the health inequity data and align it with some of the social determinants data. So it's I think a really valuable approach that certainly I think would be something that it sounds like it could be of value for you all as well as you move forward in this process.
Mm-hmm. And sometimes what could be helpful in that process, and it sounds like you have a lot of resources in Guilford too, is to have like a technical assistance provider be a part of that network as well. So when there are certain groups that might be, you know, facing challenges or might need some support, working with that technical assistance provider to help them address some of those gaps or challenges could be helpful. But really learning from each other, just venting about, all right, I'm trying to do this process. I'm not getting any responses from the survey. What are you guys doing to get responses from your partners? Working together as a set of organizations to do that could be really helpful. Any other questions? Can everyone access the link that I put in the chat box? I'll drop it again. Awesome. So feel free to use those tools, utilize those tools. They're great resources. We really appreciate your time. I know virtual trainings we are all on Zoom all day. Zoom is my date for the day, every day. So it's quite exciting. But we really appreciate your time and attention. But if you all have any questions for us, I think I took down my slide really quickly, but I'll drop our email addresses in the chat box too, and we could serve as a resource for you as needed.
Thank you, Abby. This is Jean Workman again with the Coalition and on infant mortality, and we just wanted to make sure that we ended on some good notes today. So we're making an announcement. The Guilford County Coalition on Infant Mortality is going to begin a collective action strategic planning process. It's to kick off in June. We're partnering with the Get Ready Guilford initiative. This collective action strategic planning process will identify a bold goal for reducing infant mortality in our community, as well as eliminating the racial disparities, the immense racial disparities attributing towards that infant mortality rate. We want to identify some collective action strategies to achieve that goal, and then develop some cross-sector action teams to implement those strategies. We believe this will be about a year-long process, but we also believe that the community is ripe and ready to get involved in this, and we're looking forward to involving community members from those high-impact zip code areas that are so impacted from infant mortality and these racial disparities. Leaders in our community and community stakeholders, those who work in the field to improve maternal outcomes and birth outcomes for our mothers and babies, all will be invited to participate in this community-driven approach. And we're very excited that Root Cause has been selected to facilitate the process. And we are so ready here at the Coalition to get started with that. And then in addition to that, I'm gonna try to move to my next slide and hope that this works. We would like to announce an additional training coming up in July that Abby and Mike will also be leading. And I'm trying to get my slide to move over. Stop sharing for a second and share again. We'll do our July 9th will be our local convening of Community Action for Healthy Babies Consortium. Many of you here on the webinar today are, in addition to this CAB, what we call this consortium in our community, members. And if you've got interested in taking part in this, we'll be sure to include you in the Eventbrite that goes out. But we'll do a training with Abby and Mike on communicating equity that day. So more information will come for that convening. We were hopeful that we could do something in person, but believe that it will be another virtual convening on July 9th. So more to come on that information. Thank you all for your willingness to be with us today and for participating.
Really I got a great quote.
Okay, good.
Awesome to close out. You know, someone said, implicit bias shows up far too often in many leaders and makes it difficult to make systemic changes. Talking about bias is extremely challenging. No one wants to do it. However, it must happen more often to create stronger, more ethical organizations and communities. You know, and we don't know what our implicit biases are. That's why it's called implicit bias. So we encourage you all to consider looking at the implicit bias, implicit association testing, to figure out what might be some of your biases that might inadvertently be affecting how you interact in your organizations as well as in community that you don't even really know about. So, yeah.
Thank you very much, Abby. That is so true. So thank you all for joining us again today, and it has been recorded. We will send out an email link along with the information that Abby and Mike shared. Thank you, Abby and Mike, for your time today.
Thank you all.
Thank you.